For you. We're going to be talking about colorectal cancer and other, right?
Yes.
Here's my question. I've studied last night. I wanted to make sure that I had the perfect question for you. Here
I'm
it is.
ready.
Why isn't there a better way to cleanse the colon before a colonoscopy? Why isn't there something we try drinking that dreck that's in the... Why? Why? Medical science, doctor. We can cure cancer in some people. We can't change the... At least, can we change the taste of it?
So, two comments.
Yeah.
With respect to colorectal cancer, we can do better than curing it. We can prevent it.
Excellent.
We can prevent it from happening in the first place. That is a rather unique feature of colorectal cancer. Most cancers are not preventable. Most cancers can be detected early. Colorectal cancer can actually be prevented before it even happens, which is the true primary prevention. With respect to the so-called bowel prep or bowel preparation, you haven't looked at the whole menu.
Well, obviously not, because I wouldn't have chosen that.
Yeah, we have a menu for you. We have 4 or 5 entrees. There are different options that you can choose from. And there are also medications that can be used to minimize the side effects, such as nausea.
Now, let's talk about a couple of the options for this. Because I think this is one of the, seriously, I think this is one of the things that keeps people from participating in getting a colorectal exam like this. Because it's the unpleasantness, not only of, 40 hours of back and forth to the job, but what are some of the things that you can do?
So it doesn't have to be 40 hours. I mean, most people can work normally the day before, as long as you just drink liquids. And then in the evening, they can take a combination of laxatives and cathartics, and then within 3 hours or so, generally there is an effect, and most people sleep through the night, and then they get a ride to the facility the following morning.
Because they can't stand.
Well, no, because it's not safe for them to drive back.
Yes, that's right.
And so after they've been sedated, it's not safe for them to drive back.
Now let's talk about this, because I'm going to say, I'm a very healthy guy.
Great.
Never drank, never smoked, don't do drugs, although some people think I do. I did have I have a heart problem. But let's talk about this procedure, because so many people just don't even want to hear it. And I think it's so important because, like you say, this is where you can prevent. You can really find symptoms well before there's a problem. Is that true?
Absolutely. So what I'm saying is colorectal cancer is common enough in the United States. It affects roughly 150,000 people every year. There is an indication for screening. And screening literally means we do a test in the absence of any symptoms. In other words, if someone is bleeding, if someone is having abdominal pain, if someone is having any type of symptom, that is no longer screening. In other words, at that point, we have to find the reason for it, and it may or may not be cancer. But screening is indicated for common conditions like breast, colon, prostate, where in the United States there is a relatively high incidence. But instead of all those common tumors, the only one that we can prevent from happening is colorectal. And the reason why that is that colorectal cancer develops from a normal lining in the inside of the colon to a benign growth that over time, over the course of years, maybe 5 to 10 years, turns cancerous and is accessible. We cannot prevent breast cancer. We cannot prevent prostate cancer. We cannot look into those organs. We can only catch those early. But if you look at the incidence of colorectal cancer in the United States from, let's say, 1990 to today, in the past 25 years, the incidence has actually gone down. And so that is a success of prevention techniques. So Medicare, for example, would not reimburse colonoscopy for screening until the year 2000. So I participated in the national colon polyp study, where we had to prove that by removing polyps, we could actually prevent the cancer from happening. So colonoscopy is the only way to remove those polyps. So it's not pleasant, but it's well worth it.
Yeah, when you say the word, it's attainable. you can get to. It's accessible. It's the excess that gets me crazy. We're going to take a break, and when we come back, we've got more with Dr. Pricolo. This is very important stuff. You know, this can literally save your life. I mean, this is not only a lot of hyperbole. This is the real thing, and you need to be to understand exactly how important it is. So keep your radio turned up, and we're going to tell you exactly how we can fix this. Stay tuned. All right, Dave Kane with you in for Phil today and tomorrow, and then he'll be back on Monday, so stop crying, lady. Dr. Victor Pricolo,
Perfect.
is my guest, and he is the Chief General Surgery, the Chief of General Surgery, excuse me. Colorectal surgery is primary. And you know, Dr. Pricolo, I was going to say when I saw that you had studied in Milan, I was going to say molto bene. But my wife reminded me that my wife's Italian, said, no, it's very well. And I thought, well, I'm talking to you, it's very well.
It's good. No, you said it just right.
Okay, well, and so we're talking about colorectal, well, the whole deal, right? Not just the surgery. So what can you tell us then? We were having a chat off the air about my doctor who is trying to get me to do this.
So, the way I look at it, it's not anybody's favorite way to spend an evening and a morning. But first of all, if the colonoscopy is normal, it gives you a tremendous peace of mind, and you're good for 10 years.
Yeah.
In the absence of any other risk factor. So it's not something that has to be done that often. But the way I look at it is we all need a little maintenance here and there. Like, you know, if you maintain your car well, you know, change the oil and filter, yeah, rotate the tires from time to time, you run better. So, and you need to have it done before the symptoms happen to truly prevent it.
Now, do you, when you do, if you find polyps, do you normally remove them right then?
Absolutely.
Yeah,
that's exactly the point. And,
okay,
and the truth is, we have developed newer techniques so they can be removed endoscopically. And even if there is an early cancer, in most cases we can remove that endoscopically. So imagine walking in with cancer and walking out with cancer 20 minutes later. Imagine having prevented cancer from happening just in one procedure that takes 20 minutes. We cannot say that about very many other procedures that we do.
Well, this is tremendous. And now, what can people do? They just call their own doctor, or do you want them to call South Coast Health?
So certainly South Coast offers an integrated system of care. So we have a colorectal care program that, along with surgeons that specialize in this, as well as gastroenterologists, can do the scheduling. We have a system called Care Connect, where patients can call directly, or they can go through their primary care physician.
So they don't need to be, excuse me, they don't need to be referred by a physician?
Not necessarily.
Okay.
Exactly. Not necessarily. And so they can be patient-driven, patient-initiated, but most good physicians, most good primary care physicians do advocate that. And incidentally, I should tell you, if you look at the map of the United States, guess which the state is that has the highest compliance with screening and prevention for colorectal cancer?
Arizona.
Massachusetts.
Oh, gee, I was off that one.
So we should be proud of that. But we're about 75% compliance.
Excellent.
But we can do better. You know, we
Yeah,
can always do better. But we're doing a good job collectively as a state.
Well, doctor, this is really interesting, and I hope if you're listening and you've thought to yourself, well, maybe I should do something. Sometimes somebody's knocking on your door and saying, go get it checked. You know, maybe somebody, I believe a lot of people who have passed, giving us little whispers, saying, psst. So if you're thinking about this right now and saying, gee, you know, I've been thinking about this, why don't you call your physician and see what you can get done. And maybe Dr. Pricolo will come and see you. I'm trying to think of how I'll just tell you this. This, like, I care what I say in the air. I once had to have a biopsy for my prostate. And of course they use a sonar probe, as you know, into the same area where you work. And they were taking clips of the thing. And I started to laugh. And my doctor said, why are you laughing? I said, 30 years in talk radio, you know how many people have wanted to put a microphone up my, well, never mind. Dr. Pricolo, thank you for coming in.
My
and
pleasure.
I hope people will come see you. You're a charming man and a very smart person, and I guess I got to stop listening. Maybe I'll go and get this done. Thank you so much.
Thank you. It was a pleasure being here.